First, some good news. Figures out today show a slight improvement in the number of patients diverted away from A&E units and faster ambulance handover times to hospitals. Now the bad. Bed occupancy is still running at nearly 95%, 10% above the recommended safe levels. And now Welsh A&E consultants have followed English colleagues in saying their departments are not safe. Our health and social care correspondent Victoria MacDonald has this report.
The Majors department at Lincoln County Hospital. Today it is busy with patients coming through all the time and the cubicles full, but it's quiet compared with just a few days ago. It highlights how volatile it can be. A cold snap, more flu and everything changes. Today the winter pressure figures for England show that the NHS did cope in parts reasonably well last week.
The figures out today do show a slight easing, very slight easing of the winter pressures, particularly in handover times in ambulances, which were so bad than the previous week. But what these figures don't reflect is the pressures that some trusts still remain under, particularly trusts like this one, where they have had an extremely busy few days.
On Tuesday, they declared the highest level of alert, Opal 4, or what used to be a black alert. That's defined as where patient safety may be compromised. Their beds last week were more than 96% full. That's 10% above the recommended safe level.
Have you ever thought it's right on the edge, that safety might be compromised?
It's a question we ask ourselves constantly. So Monday and Tuesday, as a result of these high levels, we were asking ourselves that question literally every hour and moving staff around to make sure as the numbers change, what we call the acuity of patients, the sickness of patients changes, we would adjust our plans accordingly, and we did that all the way through the day and night.
Emergency Department consultant Meg Kelly was one of the 68 senior doctors who last week sent a strongly worded letter to the Prime Minister about the crisis in England's NHS.
My managerial team are working above and beyond. They're here, all hours of the day and night trying to support the staff, making the right decisions with what they have available. But I think the fact that that number of signatories were prepared to sign and make such a statement probably reflects the severity of the current situation.
Like a virulent strain of norovirus, that concern is spreading. Emergency medicine consultants in Wales have now written to the First Minister saying safety is being compromised in all departments. They talk of too many patients, not enough beds, and of staff arriving to find patients they'd treated the previous day still there. Tory ministers will undoubtedly say they're right to criticise Labour's running of the Welsh NHS, but the Welsh Health Secretary said it was the busiest December on record, and the NHS had continued to perform under exceptional pressure. And in England, the Department of Health and Social Care said they know the NHS is extremely busy, but that it was given top priority in the recent budget. A statement literally scoffed at by the Labour leader visiting Lincoln County with the local MP, who's also a nurse here.
What? Well, this is, to misquote Donald Trump, this is a fake news agenda. This is ridiculous. On the 20th of December, the Prime Minister told Parliament the NHS was better prepared than ever for the winter crisis. Yeah? Why then? Patients being treated on trolleys? Why? Patients being treated in ambulances, in hospital car parks? Why so many older people couldn't be discharged? No, there is a crisis.
They did, of course, prepare for the winter here, but it has still been hard. And now their fingers are crossed that the flu doesn't arrive. There is a warning, however, today of a 150% rise in cases across England since the start of the year, with a fear that they have not yet peaked.